Hello, my name is Kim Brush, and my presentation is on cognitive processing therapy and animal-assisted therapy in the treatment of trauma. Following a traumatic event, it is common for people to experience symptoms of PTSD. However, not all people who experience traumatic events develop post-traumatic stress disorder to the diagnosable level. Symptoms of PTSD include persistent intrusion symptoms, avoidance of stimuli associated with the traumatic event, negative mood or cognitive changes associated with the trauma, and increased arousal symptoms causing impairment or distress. Individuals with PTSD typically have comorbid mental health conditions such as personality, mood, anxiety, and nicotine and alcohol use disorders. The resultant impacts are disability, increased mental health functioning, poor quality of life, and an inability to reintegrate into full society. Cognitive processing therapy was developed by Patricia Resnick in the 1970s at the Medical University of South Carolina and Charleston Veterans Administration, now Veterans Affairs, where she was assisting victims of sexual assault. The overall goals of cognitive processing therapy are to decrease PTSD symptoms and the associated symptoms like depression, anxiety, guilt, and shame, and more importantly, to improve everyday living and have that client get back to as much normal living as possible and enjoying their life. CPT has become the gold standard for the treatment of post-traumatic stress disorder. The underlying mechanisms of CPT cause changes in thinking that cause a decrease in PTSD symptoms. A plethora of studies have shown that it is effective with veterans, children, adolescents, trauma survivors, and it is now considered a frontline PTSD treatment in many major practice guidelines. CPT is a structured, time-limited, typically 12 sessions, although it has been expanded to 30 sessions for children and adolescents. It's a structured format that can be conducted in an individual or a group format. Therapists help clients identify stuck points or inaccurate beliefs about causes or consequences of the trauma that inhibit recovery. The sessions are for individuals 60 minutes or 90 minutes for the group sessions. And the idea is to challenge the individual to think differently about the traumatic experience, because these patterns can result in guilt, shame, and depression that perpetuate the PTSD symptoms. Clients are assigned homework because the point is to help the client learn to help themselves. They identify their triggers and learn to manage them and the thoughts that perpetuate the PTSD. Treatment begins with psychoeducation regarding PTSD thoughts and emotions. The patient becomes more aware of the relationship between thoughts and emotions and begins to identify automatic thoughts that may be maintaining the PTSD symptoms. The patient writes an impact statement that details current understanding of why the traumatic event occurred and the impact it has had on beliefs about the self, others, and the world. This is done through the ABC worksheet. In this example of an ABC worksheet, we can see how something happened, the activating event, shooting a Vietnamese woman while in combat, leads to the consequences of feeling guilty when the belief is, I am a bad person because I killed a helpless civilian. When we change the belief system to, in this situation, she appeared to be one of the civilians engaging in combat, then the consequences change. Next, the patient begins the more formal processing of the trauma or traumas. When a patient has experienced one trauma, it makes them more likely to experience more trauma. and put themselves in risky situations. The patient writes a detailed account of the worst traumatic experience, which the patient reads in the next session to try and break a pattern of avoiding thoughts and feelings associated with the trauma. The therapist uses the Socratic questioning method and other strategies to help them question his or her unhelpful thoughts about the trauma. These can be self-blaming thoughts, for example, in order to modify any maladaptive thinking. This is called the challenging belief worksheets, where the clients learn to, with the help of the therapist, dispute their own thoughts and beliefs. And that is through Socratic questioning, which is a series of questions regarding the client's thinking to help them learn to think differently about the traumatic event and to challenge their own beliefs. In this slide, we see examples of stuck points across the 5 dimensions that are dealt with throughout the course of therapy. If we believe, for example, I cannot protect myself or others, we will always feel responsible and guilt and shame for not being able to maintain that safety for other people. And these stuck points are what need to be challenged through the stuck point worksheets and also through the Socratic questioning in order to alleviate these manufactured emotions. In sessions 7, 8, and 9, the therapist and the client deal with safety and trust issues and continue unsticking stuck points. They also deal with power and control issues. They review this challenging beliefs worksheets, and they develop the final impact statement. They work on self-esteem and other esteem, which are boundaries, trusting self, and identifying red flags in relationships with other people. In the final 3 sessions, the client continues to work on power and control issues. They develop a final impact statement and review the challenging beliefs worksheets. And they work on intimacy stuck points and identify any other remaining issues. The client is reaffirmed by the therapist that they have learned how to be their own therapist and that they are able to do so and to live a healthy life. Limitations to treatment include premature dropout and poor treatment response. In fact, these are the most common challenges to treatment. These limitations necessitate an exploration of possible adjunct therapies to these established treatments to enhance their effectiveness. Animal-assisted therapy, or AAT, and more specifically the use of psychiatric service dogs, could serve as a useful addition to traditional therapy, increasing therapy skills practice and decreasing feelings of isolation and emotional numbness reported by those diagnosed with PTSD. Before I get more into animal-assisted therapy, I just wanted to clarify a few terms because there is some confusion surrounding them. Assistance animals is an umbrella term for all animals that are called helping animals. The first is a comfort animal, and they provide the owner relief from distress. It can be anxiety, it can be fear, what have you. It can be any species of animal, but it is not covered by the Americans with Disabilities Act, and no training is required. About 1.5 years, maybe 2 years ago, a woman tried to board an airplane with her comfort animal that was a peacock. She was told before she arrived that the peacock would not be allowed on the plane, but she tried it anyway, and it didn't work. There is some crackdown more recently on comfort animals because they are not trained. The second type of animal is a service animal, and they provide assistance directly related to a person's disability. They have broad access to public places under the ADA, so they can go anywhere their handler goes. They are only dogs, and every once in a while it's a miniature horse. They have incredibly high levels of training, like a seeing eye dog. A friend of my daughter's has a seeing eye dog, and I watched the girl and the dog walking down the street, and there was construction on the sidewalk. So the dog actually looked back and did a traffic check to make sure that it was safe for the girl to walk out into the street to avoid the construction. And then the other type is a psychiatric service dog, and they are trained to help veterans specifically with PTSD symptoms. The third type of animal is a therapy animal, and they assist counselors, teachers, clinicians in various settings. Their training is dependent upon the services they provide within the sessions that they're doing. They have no guarantee of access to public places. In fact, they need to be invited in to provide their services. The goal of animal-assisted therapy, or AAT, is to provide long-term group or individual therapy for survivors of trauma that incorporate animal-assisted interventions, or AAIs, in conjunction with exposure therapy, cognitive behavior therapy, cognitive processing therapy, empowerment therapy, whichever therapy is being utilized. AAIs that occur when trauma victims seek health-related services has the potential to reduce distressing symptoms by reducing re-traumatization and discomfort. Specifically, the goals of AAT are to assist in normalizing the trauma experience, provide a calming agent, establish rapport, and help to develop a therapeutic alliance with the healthcare provider. The domestic dog that we currently know has been fully domesticated and has been our companion for far longer than our other favorite pet, the cat. Fossil evidence shows that since the Paleolithic age, or 2.5 million years ago, dogs have been linked to humans. This mutual relation has caused the selection of the ancestral wolf to occur artificially because the wolf's proximity to man and because of some of the wolf's useful characteristics, like hunting, guarding farm animals, and companionship. In 1859, Florence Nightingale, the founder of modern nursing, wrote, "A small pet is often an excellent companion for the sick, for long chronic cases especially." She actually carried a bird around with her in her pocket, and she would let the patients pet it, and she realized that it decreased their stress and helped them to feel a little bit better. In the 1930s, Sigmund Freud believed that his dog Joffe could sense a patient's tension level. The closer to the patient Joffe was, the lower the patient's tension. Also, Freud noticed that initially patients felt more comfortable talking through Joffe. This interaction served as a bridge between Freud and his patient until the patient felt comfortable enough to talk directly to him. In 1940, during World War II, a tiny Yorkshire Terrier named Smokey was found in a foxhole by members of MacArthur's 5th Air Force. Corporal Bill Wynne saw Smokey and purchased him for £4. Throughout the next 18 months, Smokey and Corporal Wynne were inseparable. Together they completed 12 combat missions and were awarded 8 battle stars. When Corporal Wynne became ill and required hospitalization, Smokey was brought to his bedside. The tiny terrier was such a hit with recuperating soldiers that he was allowed to stay and sleep with Corporal Wynne. During the next 12 years, Smokey continued to lift spirits and bring comfort to many physically injured and suffering soldiers. AAT is based in 2 principles. Over 70% of children and adults have a natural tendency to open up in the presence of animals. And second, there's a stress moderating effect to an animal's calm presence. They reduce stress, and people like to open up to them. Today, testing and certification is required of therapy animals. This testing and certification takes place in 2 stages. The first is a general temperament test, and the second is a demonstration of confidence and control. A dog's temperament is largely based on instinct, but his environment also influences the behavior. Some dog experts define temperament simply as the dog's personality, which is also defined as a combination of instinctive and learned behaviors. In the early years of domestication, ancient humans understood that breeding for temperament produced a relatively stable canine with a known attitude over time and different situations. The demonstration of confidence and control begins with a test, and there are 13 basic commands that start with sit, stay, and recall, meaning no matter where in the room the animal is, they need to return to their handler. They can't eat anything off the floor, because if you're in a nursing home or a rehab facility, there could be medication on the floor, and if the animal eats it, they could be harmed. And then from there, oh God. Stage 2, the demonstration of confidence and control, begins with 13 basic commands. Sit, stay, down. They can't jump on people. They can't pick up anything off the floor, because if you're in a school or a rehab, that could be medication or a crayon or something that's harmful to the animal. No matter where they are in the room, they need to come back to the handler without question. And then from there, the commands and the tasks that they learn can be individual based on where they go. There is no I in team. Therapy dogs and handlers are a team, and they are tested and pass as such. So if you have more than one therapy animal, you have to go through the tests that number of times. As I mentioned earlier, a handler needs to know their dog in order to have a good either individual or group pet therapy experience. As can be seen in the canine ladder of aggression, dogs will use the fight, flight, or freeze in order to let their handler know that they're uncomfortable. Obviously, the fight is the last step, the biting, but before that, they will yawn, they will turn their body away, saying that they're not interested, they are uncomfortable. My dog Jake and I went to a physical therapy rehab, and there were wheelchairs and people and lots of noises, and he kept pawing me. He kept saying, I'm not comfortable, I'm not comfortable. He wanted to leave. He didn't like that particular experience. The floors were really slippery, so for him it was uncomfortable. So I knew that I could not take him back there. Winnie, on the other hand, she loves that place. These are my two therapy dogs. Jake is on the left and Winnie on the right. Part of being a responsible therapy dog owner is knowing which environments a dog is most comfortable in. Jake, who is a bit more reserved and likes quieter, more one-to-one interactions, does read to dogs programs. And again, the more one-on-one, quieter interventions. Winnie just loves every interaction we have, and she will go anywhere people will pet her. So she goes to substance abuse rehabs, she goes to schools, she goes to fundraisers, she goes to physical rehabs where there's machines and wheelchairs, and she just loves everyone that we have. A calm, attentive dog can moderate stress responses more than the presence of an adult or even a supportive friend. These person-centered experiences have proven to lower blood pressure and heart rate, reduce loneliness and isolation, decrease anxiety, and the presence of an animal also improves mental outlook and a person's quality of life. Studies have shown that AAIs reduce cardiovascular disease risk as well as having cognitive benefits. Therapy animals also offer a unique form of support to children's learning, physical health, and well-being. They are what is called a social lubricant. They provide an ease into difficult situations. And they increase rapport building, which is an important precursor to change in both individual and group counseling. And importantly, children are 10 times more likely to approach a student with a disability when a service dog is present. Animal-assisted therapy interventions offer Rogers' concepts of unconditional positive regard, empathy, and congruence. The main components of social support are thought to help mitigate adverse responses to stressful events. The buffering hypothesis relates to knowledge that there are supportive others who could be called upon to assist if needed, whether it be with advice, goods, or empathy. Though animals cannot provide material goods, human-animal relationships are often comprised of similar components to human-human relationships that yield social support. Specifically, these relationships often include positive regard, reassurance, and the simple act of being present during difficult times. As attachment theory postulates, children seek to make secure attachments with those in their environments. It is most often their mothers who provide comfort and support in emotional times. Knowing that there is a safe place to return to gives them confidence to explore the larger world around them. They can return to their safe base as needed. As people mature, this comfort is sought from other individuals. A therapeutic alliance seeks to create a safe environment in which clients are able to explore and work through difficult situations, thoughts, and emotions. Therapy dogs can provide an additional element of security to a client to allow them to do this. Therapy dogs, unlike humans, are allowed to provide tactile stimulation to humans. Touch is an essential piece in therapy because it provides a sense of safety and trust. Children can communicate their thoughts and feelings to a non-judgmental ear. Children are more likely to trust and more easily bond with a dog. Since the dog trusts the therapist, the child is more likely to trust them too. And this creates what I have called the trust triangle. Petting the dog makes the child less anxious and more apt to communicate with the therapist. People just feel more comfortable with animals these days. Animals are not at war or committing mass shootings in nightclubs or schools, and they absolutely love everybody. Experiencing trauma at any age can be significantly detrimental. However, it is particularly problematic during the formative years of childhood, 4 to 18. Whilst most children are remarkably resilient in response to adverse life effects, approximately 30% will develop persistent stress, fear, and avoidance, impeding their ability to function and leading to clinically significant PTSD. Official practice guidelines for treating childhood trauma do not recommend the prescription of medication. It is suggested that AAT may represent an effective and acceptable complementary adjunct for CPT. AAT involves the goal-directed use of a trained therapy animal in specific clinical interventions. A recent meta-analysis concluded that canine-assisted therapy was an effective intervention for childhood PTSD. Abuse of both children and animals is connected in a self-perpetuating cycle of trauma-related instances. Children in group therapy with therapy dogs showed significant decreases in trauma symptoms, as well as significantly more change than those in groups without therapy dogs. Hamama et al. Studied the effects of canine therapy on female adolescents who experienced physical or sexual trauma, but were not cooperative with individual interventions. This study found that trauma victims felt more control and mastery due to the canine assistance in the group. Through the millions of years of connection between dogs and humans, dogs have developed what are called socio-communicative abilities, meaning that they outperform primates in understanding of emotion, tone of voice, and body language. I went to a memorial service for a young woman who sadly committed suicide. The line to pay respects to the family snaked through this very large room, out the door, and onto the boardwalk outside. We were near the ocean. And Winnie walked around the room, smiling at people, greeting them, letting them pet her. And then at one point, she pulled me between a row of chairs to a man who had his head resting on the chair in front of him. She walked up to him, nuzzled her nose into his hand, and he started petting her, and he sobbed. It was the most amazing experience ever, because I didn't direct her to him. She picked him out in this crowded room. Sociocommunicative abilities. In 2011, the ADA added service dogs to the approved services for veterans with PTSD. Because of the social acceptance of showing affection towards animals, it seems a natural way to bridge the gap between the stoicism often associated with males, especially military personnel, who often have difficulty with emotional expression. As a general rule, males in North America are resistant to asking for and seeking help. Chris Blazina goes as far as calling it a crisis of connection. Dave Sharp was so traumatized during his multiple deployments that his anxiety and recurring nightmares kept him confined to his home. He says, "I was always looking for a fight. I was beating on the walls." He says all that changed when a friend encouraged him in 2002 to visit an animal rescue shelter. He spotted 2-month-old Cheyenne. Not long after he adopted the brown and white pit bull mix, Sharp had another dream about a Taliban sympathizer who pulled a gun on him. When Sharp woke up in a cold sweat, the dog was watching him. "What are you looking at?" he recalls yelling. Cheyenne barked in response, and after he told her to shut up, she barked again, prompting him to wrap her in his arms, collapse on his bed, and tell her everything that was weighing on his mind. "I just lost it," he says. "I have no idea why, but I felt completely safe." Psychiatric service dogs help by alerting the owner to increasing anger, fear, anxiety, agitation, or unhealthy levels of arousal by responding to cues exhibited by the handler. These can be fidgeting, clenching of fists, sweating, just a change in their demeanor, and they're trained to notice these things, but also because of the socio-communicative abilities dogs have, they can sense them more easily. As a result, owners can be cued by the dogs to use therapy skills, for example, relaxation training or self-soothing techniques such as breathing and mindfulness practice. For flashback symptoms, the dog may be trained to note physical signs of an upcoming flashback, usually a physical tic, a body movement, or zoning out, and the dogs interrupt the owner, potentially reminding the owner to remain in the moment and practice therapeutic skills, breathing and mindfulness, for example. An additional use of a psychiatric service dog is to facilitate re-engagement in everyday life. This is particularly beneficial with PTSD, where avoidance is often a primary coping strategy. The dogs are also trained to do what's called sweeping and blocking. Like in the military, they would go into a room and make sure that there was nothing in it that could be harmful to the others, the handler in this case, and blocking meaning keeping other people away. A study conducted by the Department of Veterans Affairs aimed to investigate the effects of a new program that integrated highly trained psychiatric service dogs with an intensive psychological training program on managing symptoms of PTSD. A secondary aim was to examine the effects of the program on secondary symptoms. Overall, findings indicate that this version of training was associated with decreased symptoms of PTSD and depression from pre-treatment to post-treatment and pre-treatment to a 6-month follow-up. Specifically, military veterans with severe levels of PTSD, moderate to severe comorbid symptoms of depression, and difficulty with anger-reported responses decreased in symptoms at post-treatment as well as the 6-month follow-up. Psychiatric service dogs do help individuals with PTSD navigate life with their symptoms. Some of the tasks the dogs are taught are controversial and contrary to evidence-based practice in the context of traditional PTSD treatment. These are the safety checks and the blocking that I mentioned previously. Some suggest that rather than teach dogs to perform tasks that may continue to perpetuate the individual's exaggerated fears that the world remains a dangerous place, it would be more in line with current best practices to treat psychiatric service dogs to perform tasks that permit individuals to engage in previously feared as well as once enjoyed activities. There were a couple other criticisms that one being conducting well-controlled studies with animals is complex because there's so many different sources of animal-human interaction. There's also difficulty in consistency of training and also maintaining the training. The animal could be taught something by their trainer, and then when they are placed with the handler, they don't maintain that level of training. And participants, they don't want to take part in a study where they don't get the treatment. In this case, the dog, right? Would you want to take place in the study and not get the dog? I wouldn't. And then there are some studies that suggest the positive therapeutic effect are limited by self-report bias. They like getting the dog. Cognitive processing therapy is the gold standard for treating PTSD. It is an empirically supported treatment for survivors of sexual assault, veterans, as well as children and adolescents. Humans and dogs have a long history of companionship. There is both empirical and anecdotal evidence that supports the efficacy of using therapy dogs in therapy as an adjunct to treatment. Psychiatric service dogs have also aided military veterans with the treatment of PTSD. The use of psychiatric service dogs could serve as a useful addition to traditional therapy, increasing therapy skills practice and decreasing feelings of isolation and emotional numbness that is reported by those diagnosed with PTSD.